a general surgeon at the Longstreet Clinic. I perform robotic procedures as well as other surgeries. But first and foremost, we want to thank you guys for coming into our Facebook Live and listening to us chat a little bit about robotic surgery and the advantages and opportunities within that. I'm here with two other surgeons from the Longstreet Clinic who, along with myself, we've been designated as surgeons of excellence in robotic surgery just recently. So I'm here with Dr. Daniel Mullis, who's a Longstreet Clinic general surgery surgeon and a member of the hernia center at Northeast Georgia Medical Center. And I'm also here with Dr. Keshma Sajani. She's a gynecologist at the Longstreet Clinic and a surgeon of excellence, as we said. Now, before we really dive into some of the questions, we want to just give you a little bit of recent news. So the Northeast Georgia Medical Center recently made history of as the first and only hospital in Georgia to receive accreditation as a center of excellence in both robotic surgery and hernia surgery. The Surgical Review Corporation is an internationally recognized patient safety organization, and this organization recognized Northeast Georgia Medical Center for its dedication to delivering safe, effective, and evidence-based patient care through its independent external process of evaluation. And they recognize 9 surgeons for their as surgeons of excellence. 6 of them are with the Longstreet Clinic, 3 of whom are here tonight. The others are Dr. Fernando Isinena, who's a colorectal surgeon, Dr. Chad Copper, who's a general surgeon, and Dr. Robert Richard, who is a bariatric surgeon. So in light of this recent event and our excitement about the new accreditation, we wanted to talk a little bit about robotic surgery and some of its advantages, what makes it a little bit different, and what types of procedures may be available to you. So we do have some questions planned to talk about, but if any of you have any questions during our live broadcast, please feel free to submit those, and we'll try to get to some of those if we can. So first, I want to start with you, Dr. Mullis. So we do a lot of procedures across a lot of different specialties, and some of them have common approaches, but for very different surgeries. When it's a gynecologist like Dr. Sajani or a general surgeon like we are, we sometimes have different approaches to surgery, and just wanted to talk about some of the benefits and maybe some of the disadvantages of some of the options we have available to us and our patients.
Sure. I think it's a great question. And I get that question a lot in the office when I'm talking to patients. Surgeons are by far the problem solvers when it comes to medicine. And we look at problems that are diagnosed sometimes by the physician, sometimes by ourselves, and we try to figure out what tools and techniques can we use to solve that problem. And for 100 years, it was open surgery. And open surgery to an average person on the street is the traditional scalpel, making typically larger incisions, using mainly our hands, and which results in more pain, longer hospital stays, higher risk of complications, infections, things like that. The past 25 years in surgery, the techniques to solve problems has rapidly expanded. The tools have changed. The ability to actually fix the same problem that a surgeon like me 100 years ago would fix, they've all changed. The tools have changed, and the techniques have had a rapid expansion, and that they're very complex. And so we need better tools. And those tools came out in the 90s with laparoscopy. Actually, Dr. Sajani would know the gynecologist is actually the first surgeon that did laparoscopy. They had to look in ladies' pelvises for 100 years ago. So actually it wasn't a general surgeon, it was a gynecologist that invented laparoscopy. We just took that tool and we used it to solve the problems that we see in our world. Robotics has been on the stage since the early 2000s. And I will tell you, I saw one at a surgical conference in 2002. And it's akin to, hopefully if you're watching Facebook, you know a lot about technology, you're savvy, and it's like playing Atari. No one would use this to fix the problem. Whereas Intuitive, the Da Vinci maker, they've had rapid advances in what we can do. So the machines are extremely well designed. I tell the patients it's like me putting on a bodysuit, and like Iron Man, my wrist turns 270 degrees, whereas I'm in that machine and it'll go 540. And so there are things that you can achieve robotically that you can't achieve laparoscopically. So you asked about, you know, advances in what we use. It's all a tailored approach, not one size fits all, but we certainly like to do things that are minimally invasive. Gynecologists would agree that they have, if they can achieve the same outcome and solve the same problem, we're going to do that because it's less painful. An inpatient stay may turn into an outpatient stay. Patients get the same gold standard outcome and they're happier. I'll leave it at that. Keshma, do you have comments to that?
No, I'm going to expand on that with the next question. Dr. Bush, what's my next question?
So for you, we wanted you to talk a little bit further about robotic surgery. And, you know, I've been asked more than once, is the robot doing the surgery or are you doing the surgery? So and I always kind of chuckle a little bit, and I have to, you know, back up and kind of say it's, you know, it's basically a tool that we use. But can you bust that myth for us a little bit and tell us about the actual technology of the Da Vinci system?
Absolutely. So that's a common misunderstanding that the robot's performing the surgery, and it's completely not the case. The surgeon is in control of all the movements, and the surgeon makes all the decisions. So I want to kind of describe the system. So the robotic is really a system, and it's a system with three parts. You have the surgeon console, and this is where the surgeon sits, and this is what it looks like.
Nice pictures.
Yeah, I got you some pictures. You have the patient cart. This is the robotic arms. And then you have the vision cart. All of our visualization is in 3D, and this is called the vision cart. The three of those make up the whole system. And what happens is the system translates the surgeon's movements into precise movements in the body. And as Dan was saying, this technology, it was 20 years ago, was approved by the FDA to be used in the hospitals. And the reason why that they needed something like this is that they were trying to enhance the surgeon's capabilities of performing surgery by improving visualization and range of motion. So the basic procedure is that the surgeon makes maybe 3 to 5 incisions. These are 8 millimeters in size on the patient's abdomen. We then insert instruments called trocars. And once the trocars are inserted, we put the robotic arms and we secure the robotic arms to the trocars. And this is called docking. We call this docking the robot. Once the robot is docked, we insert the working instruments and then we insert the camera. After that's done, the surgeon goes and sits at the surgeon console and performs the surgery. And by performing the surgery, we're utilizing the master controls to make these movements that are translated into the precise movements that perform the surgery. The surgeon is in control at all times of all these movements. And in the past, as we know, that they used to make larger incisions. Now with this technology, you can perform the same surgery with smaller incisions, shorter hospital stay, less pain, less infection, faster return to daily life. For me, the most important thing is I feel like I can do many more challenging surgeries, patients that are much larger, obesity, scar tissue. I'm able to take out larger fibroids, ovaries, ovarian masses. So this technology has been awesome for the GYN field.
Yeah, I would agree. I think general surgery was a little bit late to the game with robotics compared to a field like urology, but it's busting at the seams as far as how we're using the robotic technology in general surgery, and I think it's just getting started as far as the capabilities that we'll have as this technology continues to develop and become more advanced. Now, another amusing question that I often get is parents who are concerned about their kids playing too many video games, and they're asking, hey, I'm spending all this time on the video game system. Are they training for robotic surgery? And again, I have to kind of chuckle about that. But there actually has been studies that have proven in the past. I haven't seen any studies specifically about robotic surgery, but I have seen studies in the past that showed that surgeons who played video games as children actually are better laparoscopic surgeons. And I think that translates very easily into robotics, if not even more so. It's got to do with hand-eye coordination and developing some of those skills. I wouldn't necessarily advise someone to encourage their kid to play lots of video games. I think there's other skills that they could be developing that would also make them good surgeons as well. But I did want to talk a little bit about training for robotic surgery. So surgical training begins after medical school. So typically a physician will go to college, then go to medical school. Those are usually 4 years each, so 8 years total, and then go into surgical training. And it depends on the field. Some surgical fields are 4 years, some are 5 years, some are even longer than that. But during that training, we get trained in the skills that we will need to perform the procedures that we'll need to do for patients. Well, now most, if not all, general surgery programs are actually training surgeons during their training on the robot. And so oftentimes, as Dr. Sajani showed a minute ago, there's a surgeon console. During training, there actually is oftentimes a double-sided, a two-sided console where the attending surgeon or the training surgeon will be on one side, and the resident surgeon or the trainee will be on the other side, and is developing these skills. And as they proceed through training, they're allowed to do or participate a little bit more in the surgery. And I think that's a great way to do it. Some surgeons who are already out of training and already practicing prior to the development or the usage of robotics in general surgery or gynecology or urology, whatever the field may be, they have a training process to go through, and they have to be accredited by certified by Da Vinci, and then they go through their hospital credentialing process. And many times they have proctored cases, and there's a whole process that a surgeon has to go through before they're allowed to be a robotic surgeon and do robotic surgery. But it's in my own personal journey. I'm very glad that I'm a robotic surgeon, and I am sometimes glad that I played video games as a kid. Mike Tyson's Punch Out, Contra, some great games back in the 90s, but don't necessarily push those on your kids. Dr. Mullis, did you play video games as a kid?
I played, my first video game system was the Atari 2600. So I've seen the gamut.
Nice.
And I sort of agree with that. But, we would all agree that it's your brain power in your head more than it is your physical skills that are helping you out the most in the operating room. It's like they tell you the first day in medical school, they'll tell you, we're going to teach you 4 years of stuff. 90% of it's going to be different when you're done. And the same goes through any discipline, any specialist who trains. They're going to be, you get trained by your teacher, and your teacher may be teaching you something that's 20 or 30 years old.
Sure.
Most physicians are constantly learning new technologies, diagnosing new problems, learning new techniques. And so if you're in training currently, yes, most surgeons coming out are experienced with robotics. Whereas if you've been in the field for 20 years, you'll have to either go through different training courses. And there are surgeons who are just about to retire who may say, I don't have the time to learn all these things. But the Da Vinci robot, the intuitive surgical company, has made it quite easy for surgeons in the community to learn new skills. And they were certainly very instrumental in my training. And the hospital at Northeast Georgia Medical Center was quite progressive. I think they're way above the curve in pushing new technology and helping to push ourselves to provide better services and care.
Yeah, I would agree with that. Go ahead.
I was going to say, I absolutely agree, because I've been doing robotic surgery for about 8 years. So I was one of the first when they first got the robot in training. And Da Vinci themselves, I mean, we went to several training courses. They would watch your videos. The course administrators would teach you on how to be better at what you're learning at. So, and, you know, we had cadaver training and things like that.
Yeah, I think that's an important point to think about, how even if we're out of training, there's still new technology out there, and we're constantly growing in a field. And I think that's one area that Longstreet does very well at is being cutting edge. I think Longstreet Clinic and its providers are incredibly sharp, incredibly caring, but we're also cutting edge in the treatment that we offer to our patients. And I think robotic surgery is an example of that, and the options that we're able to give our patients and the incredible care that we're able to give. Now, I mentioned earlier that the Northeast Georgia Medical Center recently was given the accreditation as a surgery center of excellence. And there were, Longstreet Clinic has 6 surgeons of excellence. So, Dr. Mullis, can you talk a little bit about what that means to have a surgery center of excellence and what it means to be a surgeon of excellence?
Sure. Center of Excellence, that moniker has been around for a while. It is basically a health system or center that has made a commitment to protocols, standards of care, outcomes. So we police ourselves. We are looking for the lowest complication rate, best outcomes. We track and keep records of the cases that we're doing. So it takes a lot of work from the member surgeons, the administration, to provide that data to invite some corporation, and that's the Surgical Review Corporation, to come down, do a site visit, and look at our numbers. And they've seen that the thousands and thousands of procedures we've done over the past probably 7-8 years, qualified to receive that highest of recommendations. And we're proud to be, and I'm sure you are, and Keshma is, the first in the state to do it.
That's right. It just shows the work that's been done through the Longstreet surgeons, through Northeast Georgia Medical Center over the past few years, developing this program, and now we get some of the credit for what's been going on. Are you proud to be a surgeon of excellence, Dr. Sajani?
Yes, I absolutely.
I bet you are. Well, I can attest to you being a surgeon of excellence. I've seen your work. Well, Dr. Sajani, you're sitting here with 2 general surgeons. The cases that we do, the procedures that we do are very different than yours. Can you talk a little bit about what you do in gynecology, what procedures you do on the robot, and what cases are appropriate and maybe not appropriate for a robotic approach?
So I do 100% of my cases with a minimally invasive approach. With robotics, I can do a hysterectomy. And hysterectomy is removing the uterus, and this is for abnormal bleeding, fibroids, polyps, ovarian surgery. The one thing I like about the robot for that is I can remove a cyst from an ovary and still protect and save the ovary. And myomectomy is when we remove fibroids, and this is valuable for a woman that is having fertility issues and we want to save the uterus. Pelvic relaxation surgery, that's when the uterus is coming out and I can support the bladder and the rectum. What I have found is these women do excellent. They go home sooner and return to their routine activities much faster. There's an additional benefit, as you guys know, is we can do combined surgery. So if my patient has a gallbladder problem and a GYN problem or a hernia problem, I've worked with both of you and almost all the surgeons in the robotic program in providing that combined care. And I think that's valuable to say that.
Absolutely. So what percentage of your cases are you doing robotically now? I know you said try to do 100% minimally invasive. How much of those are robotics?
I would say over 90% are okay. Robotics. Very rarely do I have to open a patient, and I would say I do about 4 to 5 robotic cases a week, and I've been performing robotic surgery for about 8 years. I've been trained for about 8 to 9 years now.
And Dr. Mullis?
I would agree. It's probably around 90% if we're specifically looking at hernia. Again, tailored approach, not one size fits all, but the ease of use of the robot to tackle very challenging, difficult hernia, gallbladder, pancreas, colon, gastric cases. We're going to try minimally invasive. I tell all my patients we're going to try. It's not always successful. In the laparoscopic era, which is all we had, I'd say 70-30, but now it's in the 90s versus converting to open. You gain things with a robot, you lose things with a robot, you gain stuff when you open, but you lose stuff when you open. And if you can get the procedure done and solve a problem with a robot, I would say that's what we're going to do.
Yeah, mine's about the same. So as far as hernias go, I'm probably upwards of 95% of my hernias are done robotically now. And I think I think I'm a better hernia surgeon when I'm doing it robotically. And, as far as my other cases, if the case can be done in a minimally invasive way, I'm trying to do it robotically. If not, I'm doing it laparoscopically. I'm trying to do everything minimally invasive as much as possible through as small of incisions as possible. Just because it's been proven time and time again that the smaller the incisions, patients do better. They have less pain, quicker recovery, and overall they just do better. I look forward to my robot days. I enjoy it. It's a fun thing to do. I like doing robotic surgery. I wake up in the morning excited about those days. I think it's a great technology. I think it's a lot of fun. And it's nice to be able to provide a service for patients that's enjoyable for me to do. And I know they're going to get a good result and they're going to have a quicker recovery, less pain. And I know I'm giving good care to patients whenever I'm doing robotic surgery. What about you guys? What's your favorite thing about doing robotic surgery?
Well, I think for me and probably for all of you guys, one reason why we enjoy doing robotic surgery is that the program is well developed. We have a dedicated staff. Our teams are well trained on positioning the patients and moving the patients and turning our rooms over. And I think that that's a lot to say to satisfaction and patient outcomes. So the hospital has done well, and we've done well in encouraging them to do that for our patients, to be patient advocates.
I agree. It's the staff engagement. Other surgeons in the state I know I've talked to who are interested in developing over their own robotics program. I tell them one of the added benefits is you get a core group of special people that you see every day that have the same passion and engagement as I do, and they know they're doing great. And, you know, regardless of what you do in this world, if you went to work every day and got to work with people who were happy, energetic about achieving the best, boy, it's fun to go to work, regardless of what you do. And kind of just, we kind of danced around that. All of us said the same thing, but no, it's this core group of highly engaged technicians, nurses, administration who want us to succeed and do well because it's the best thing to do for the patient.
Yeah, absolutely. Shout out to the robot team at Northeast Georgia Medical Center. You guys are awesome. All right. So one of the questions that I'm frequently getting right now is about doing procedures, doing surgery during this COVID-19 pandemic. And a lot of folks are wanting to know if we're still doing surgeries, you know, have things been shut down? And so I wanted to take a minute and just kind of talk about that. So whenever this first happened, whenever it first started really ramping up in the U.S., we were, as a nation, as a healthcare system, concerned about overwhelming the healthcare system. And so it was recommended across the board by the national entities to, hey, you need to slow down on the elective surgeries. And most hospitals actually ceased doing all elective surgeries, or at least a large percentage of them. Then after things kind of slowed down and we saw, at least locally, that our healthcare system was not going to be overwhelmed, we began to open back up in a gradual tiered process. Now we are currently doing any and all elective surgeries, and we're doing them in as safe a manner as possible. Patients are being tested ahead of time. All patients who are having surgery done at the hospital are having COVID tests performed, and staff, physicians, everyone's being monitored, fairly closely as far as, making sure we're doing things safely. And honestly, I feel like it's safer to go in to the North Tower at the hospital and have surgery on the second floor. It's probably safer, and you probably have less exposure than you do going grocery shopping at Walmart right now. And so we do feel like it's pretty safe, but we are managing that closely. And trying to keep everybody as safe as possible as we continue with these surgeries. Any comment on that, guys?
I think it's important to let the general public know that every patient that we are taking electively has been screened. And the outpatient surgical part of the hospital is really as best as we can do right now. And, you're not going to the operating room with active patients that have disease if they're truly elective and they've been screened up front. So I think all politics are local, as all health numbers and statistics are local. I think we have excellent governing board members at the hospital, at the state, national level that will, I think we'll all end up doing the right thing, but for the right reasons. I think there's plenty of personal safety protection, and we have the right protocols in place. Truly elective surgery, I mean, the devil's in the details. Elective, it doesn't always mean, cosmetic surgery, or there are things that are elective, but I may end up keeping a patient out of the ER, or having to go to the hospital in the middle of the night on a weekend if I get their elective procedure done at a safe, reasonable time. So elective doesn't mean unnecessary. And
good point.
I don't want people to stay away because they were told it was elective surgery. It's cancers are elective surgery. There are not many people want to keep a cancer for 3-6 months. Right. And there are certain things in GYN, I would imagine, that are the same. So we have protocols in place, and we're adhering to the national, state, local guidelines, and our hospital administration governing board. They'll let us know if we need to slow down, but otherwise we're going to continue to take care of the people in our community the best we can.
That's right. So, Dr. Stajani, we've talked a little bit about the benefits of robotic surgery versus some of the other approaches. We talked about decreased recovery time, less pain. Can you be a little bit more specific about some of the benefits of robotic surgery?
So again, for me, I see mostly women, and my patients, I see all women. So
I was about to ask, you see mostly women?
I see all women, and my patients have to multitask between their children, their husbands, their jobs, and robotic surgery allows them to do and tend to those things much faster. They have cosmetically, their incisions heal very well, and this is important to my patients as well. They get to go home the same day to take care of their children, and they spend very little time at the hospital. The other big benefit that I've seen is that these women have better vaginal support, and they have less risk of sexual dysfunction after surgery. And these are all things that are important to them. And to me, that's one of the biggest reasons that I do robotic surgery, is that afterwards the vaginal support is very good. Surgical outcomes have been fantastic. Satisfaction rates after surgery have been very high. Pain scores have been very low, and use of narcotics have been minimal to none compared to traditional surgery. So for
Good
me,
point.
I don't see myself ever going back to the traditional approach. And, I think this has been a fantastic thing for GYN patients.
Yeah, I would agree. I think our patients just do better when we're doing it robotically. And I think we don't have a lot of data to support this yet, but most surgeons who do a lot of robotic surgery would support the statement that our patients probably do better robotically than if the same case had been done laparoscopically. And there's a few reasons why. It's got to do with the way that the instruments enter the body, and the wristed instruments, as Dr. Mullis mentioned earlier, as well as the torquing of the abdominal wall. There's a few different things that go into it, but I really think my patients do better doing it robotically than laparoscopically, and certainly better than open. But there are some cases where robotic approach is not appropriate. I think those cases are minimal when you start talking about within the abdomen or within the chest. We do have some cardiothoracic surgeons that are doing some lung surgery robotically now. But within the abdomen, which is where most of us, the three of us work primarily, the robotic approach is appropriate for most cases. There's some that if I'm working on the abdominal wall and not going into the abdomen, I don't need to use the robot. I won't use the robot. There's not a lot of situations that I can come up with where I would say I wouldn't attempt to do that robotically. Now, there may be some that are going to be difficult to do robotically and may have to be done in a traditional way. But that's not really going to stop me from trying to do it robotically, knowing that my patient would get some benefit if I'm able to complete the procedure robotically. Any comments on that, guys?
I would agree. If we're just talking minimally invasive surgery versus open, right, we're going to try a minimally invasive approach. If the tool we use is a laparoscope or a robot, I would tend to agree with the statement that robotics, majority of the time, although there are times where a laparoscope is just as good. Laparoscopic removal of the gallbladder, laparoscopic appendectomy. There are some things where you really don't need that high-powered tool. It may add a little extra time into the operating room where it's not needed. But in general, complex repairs, I think a hernia done robotically is superior to one done laparoscopically. That's my own personal opinion, just the technique that we use. But again, minimally invasive versus open is by far the best way to go. But there are times where you won't know that you can achieve that solving of a problem without trying at least robotically or minimally invasive. And then sometimes you do have to fall back to the old-fashioned, tried and true gold standard. I think Dr. Sajani would agree.
Yeah, so I think one area that we have not taken advantage of is surgical emergencies, patients coming into the ER at night. For me, it would be ectopic pregnancies. Like, I'm very excited to be able to use the robot for ectopic pregnancies, to be able to save the fallopian tube and, and a big ruptured hemorrhagic cyst. Typically we do those laparoscopically. So I do see that in the future, I bet that robotic surgery will be used for those type of cases where it's, even though it's an emergency, it's at night, and right now it's just used for elective. I think that there's some room for that.
I would agree. Now, 2020 has been a year for the record books. It's been a very interesting year for many reasons, but specifically dealing with this COVID pandemic. What's one thing that you guys have learned this year, trying to be a physician during all this madness?
For me, one thing I've learned during the pandemic is that routine checkups are important. If you're bleeding, you're feeling pain, you need to be seen. I noticed that during the pandemic, patients were scared to come, and then their problems got worse. And I just encourage them to call the office, schedule a televisit. We're here for you. We're here to take care of you. So that would be one thing that I would like to tell everyone. We're here. We want to see you. We want to take care of you. Don't let your problem become a larger problem that's harder to solve.
Very good. Dr. Mullis, anything you've learned during this madness?
That my 2 and 4-year-olds don't do well with Zoom school. I love my wife for all the hard work she puts into keeping them straight. I need my kids to go back to school. I need my nurse to be with me. I would say all the little things that you don't think about, they get magnified when you don't have them. So I thank my wife, the nurse, all the staff for everything they do. I think we're all in the same, everybody's on the front line. And we're all committed to doing the same thing. It's just take care of, as best we can, people in our community. So there's lots of people behind the scenes that don't get any credit for helping us do that. So I guess it took a pandemic to get me to say that on live. But I meant it.
Good point. I would echo those for sure. For me, I've learned that telemedicine is really something that we should be doing more of, that we could be using more in our world that is very fast paced, to have the convenience of, a patient to be able to do an interview with me or a consultation with me over their phone when they're sitting in the parking lot, sitting in their car. That's really advantageous for them. They're 30 minutes away. They're at work. They don't have to drive up to see me. There's less missed work. And anyway, as surgeons, we don't get to do that a lot because much of what we do is hands-on. But I think that's something that I took out of this, that, hey, we probably need to work on this and develop this a little bit more and utilize this technology a little bit more. But specifically talking about the pandemic, there's been a lot of talk about, how to keep one safe during this time. The advice for those who are most at risk, those who are compromised, or elderly patients, the strategy is still shelter in place if at all possible. If you do have to go out, speaking specifically of those patients as well as anyone else, we do recommend wearing a mask. Don't touch your face, don't touch your mask if you can't prevent it, and wash your hands often. So wearing a mask, has become kind of a political issue, and there's been all kind of talks about it, but it's something that you can do that does help protect you, and it also helps protect others. And there is some science that supports that, and I think it's a reasonable thing to do. Whenever you don your mask, when you put your mask on, when you take your mask off, it's appropriate to wash your hands, try not to touch your mouth, nose, and eyes. And as I said before, washing your hands frequently. But that was kind of what I had planned to talk about today. Is there anything that you guys want to say specifically, or other things that you guys want to talk about kind of briefly?
Did anybody send in any questions?
I haven't received any questions yet, so I'm sure we'll have a lot. Sure, we've got some folks watching now, and then we'll have a lot of folks watching as time goes on. And we do want to encourage you to share this video. Post this to your Facebook page. You can share it on other social media as well. But I do want to thank you guys. Thank you, Dr. Mullis. Thank you, Dr. Sajani, for joining us.
Thank you.
And just chatting about something that we all enjoy and we all love to be able to offer to our patients. We do want you to stay safe out there, but know that Longstreet Clinic is still providing all services right now. We are in 10 locations across Northeast Georgia. We've got over 200 providers. We in 18 different specialties, including primary care. So if you need your wellness check, make sure to see your doctor. If you need your colonoscopy, come see us. If you need your annual women's exam, Dr. Sajani is happy to take good care of you. But thanks so much for joining us. Take care of yourself. Stay safe. And we'll see you guys next time. Thanks for tuning in.
Thank you. Bye-bye.
Bye, guys.
Bye.